With FABRX, we have 4 years now collaborations. They give us the opportunity to improve the treatment of the patients. We make many feedback and they offer us many new developments to treat better our patients. Compound in hospital is very common to treat the unmet needs because pharma companies do not go to develop treatment to many patients. Our need is to give the patients a good treatment, that the patients will be adherent to the treatment. And 3D printing, in this case, is really a good new weapon to treat patients better. In our pharmacy, we do not use 3D printing in the same way that we used the classic compound. 3D printing allows us to increase the quality and the opportunity to treat patients with something more precise. To treat one patient, it costs around 1 hour and 30 minutes for preparing the treatment for 1 month. With a M3DIMAKER too, it takes around 20 seconds to make 1 printlet, so 30 printlets. In less than 10 minutes we can make it. So it allows us from one standard to give some patients many doses to adapt to the patient. So it is a good opportunity to individualize the treatment. What are the evolutions? First, when we go for 3D printing, we need to create all the doses one by one on the system. Today, as you have seen on the software, you can select 30, 20, 10. The software directly makes it without the time to create all the G-code one by one. It's a great improvement. For cyclophosphamide, they need to come back to the hospital every month because the stability of the treatment is very, very narrow. But now they can have a treatment, but the stability will be more than 6 months. So they just need to come every 3 months to take their treatment. They say, it's great. So the feedback are very, very good. With the printer, we have made more than 1,000 prints without any trouble. So we know that at the end, we won't have any trouble. What FABRX offers, it offers some more flexibility from the dosage without more time to do it. That's the great gain of 3D printing. We are between this revolution, but we have a very, very good feedback from engineers team from FABRX that makes many improvements of the system because today we see that we can go further for 3D printing. We can make some combination, we can make things more fine-tuning. 3D printing can be scary at the beginning. You have many different technologies which can be running in 3D printing. The first advice that I will give to the different teams is come to see what we do, how we have made all the trials and error process. Come to see, make your idea and make some collaboration. It's the best way to begin to work with it. And after that, you will see in 3 months, you will treat your first patient.